most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Hi, Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Brad, what are we going to talk about
Well,
today?
Bob, today we're going to talk about shoulder pain. And is the shoulder pain from cartilage? And there's two types of shoulder pain, cartilage that can be
Right.
from. But before we get into the details, we're going to cover this. We better get rid of this thing so we
That's
can walk
right.
around.
So we are giving away a full mattress again of your size.
Yes.
You get to pick. It's a Sleepovation mattress. It's
Mhm.
got 700 tiny mattresses.
700.
Yes. This is a sample one.
Oh, yes.
And
yes.
it's very comfortable. It's got air channels, so it's nice and cool.
Yes, I like
Uh,
that.
Both of us like our individual mattresses so much we can't do without it.
I really do appreciate mine. And these giveaways are great. We do quite a few.
Yeah, go to bobandbrad.com and go to the giveaway section, and that's how you sign up.
There you go. Okay, hyaline cartilage is one type of cartilage that can cause shoulder pain. Now,
So if I pull your arm off,
there we go. We got Sam volunteered.
right here, this smooth surface is covered with a thin, like a Teflon.
Yeah, it's white and it's smooth and slippery.
And it helps glide the shoulder along like this and that way.
And when you get arthritis in there, that hyaline cartilage, I like to refer to as like it gets kind of rusty. It gets rough.
And flaky.
Flaky, yes.
Yeah.
And then it makes pain, associated pain with movement. Now, if
Right.
there's another type of cartilage in there called the labrum, which we're going to
Right.
get to in a little bit. Typically, if you have arthritis or DJD, the degenerative joint disease, common symptoms are more general pain. It's usually with people 50 or older, associated getting worse as you get
Right.
older.
Your
Often,
shoulder's wearing out.
yeah. I would say there's no scientific proof to this, but I think you'll agree. Any therapist will say people come in before storm or with weather changes and their
Right.
arthritic joints. They say, I could tell it was going to rain
Yep.
today.
And it's funny, the research doesn't support them.
Right.
But the
But-
labrum, by the way, is a circular piece of cartilage, and we highlighted where it would be with a
Black.
marker.
So this black ring, and what that does, that helps support the ball or the humeral head where it needs to stay for proper mechanics.
Yeah,
Now-
it keeps it stable.
Right. Now that cartilage can actually tear, and that's called a labrum, and that'd be a labral tear. A real common labral tear is called a slap lesion or a slap tear, and that stands for superior labrum anterior posterior.
Right.
In other words, it tears.
In other words, you don't need to know that.
No, but it oftentimes tears in the top part. It can tear in
So,
other locations.
athlete, a pitcher,
Yes.
someone that uses the shoulder in a violent manner.
Right. Yeah, where you're
So-
aggressive. Now, in my case, and right now, I think I may have this, and I'm a swimmer. I've been swimming for
Right.
20 years regularly, and there's,
You're probably wearing it out.
yeah, wearing it out, and there's a few tests you can do for this. Now, oftentimes, if you have the hyaline or the arthritic cartilage,
Right.
if you do exercises for range of motion in an appropriate manner, it usually loosens up and starts to feel better. Now, if it's a labral tear or labral problem, if you exercise it and it continually gets worse, then that's an
Yeah,
indication that
more-
it may be that.
Right, right.
For like in my case, I can swim now, but the longer I swim, the more it hurts.
Right.
If I had arthritis and
Generally, it would start to feel maybe probably a little bit
right,
better.
as long as you didn't overdo
Right,
it. Everything
as
is
long as you
within
overdo it, right.
range of using common sense, of course. So
We have some tests,
I
right?
do want to talk about one other thing.
Oh, sure.
If you have cartilage problems, arthritis, in an X-ray, it will typically show up, particularly if it's been
The
around.
hyaline.
Yep,
So this surface will look roughened.
yep. And that can be seen in an X-ray. As it gets,
Right.
the older it is, the longer it's been around, the easier it is to see. Now the labral tear will not show
Right.
on an X-ray. You need an MRI
Exactly.
for that. So there are some manual tests, and typically they're done by the professional. We're going to show you two of them, and these you could do at home with assist of one person, uh, but don't bet a whole paycheck if they're both
Right.
positive that you have a labral tear. This is something that really you need to
Yeah.
final
You have
diagnosis.
to have someone that knows what they're doing take a look at you.
Exactly. So, should we carry on, Bob?
Sure.
All right. So, the first one is you need a partner. I'm going to stand like this, put my arms out. This is actually my sore
Yeah.
shoulder right now. So, we're doing a real test, real time.
So you got the thumbs up, or which one are you doing?
We
Thumbs
start with the
up.
thumbs down like
And
this.
I'll put my hand across both arms.
Yep,
And I'm going to push down.
and I'm going to hold. Ugh.
Now we're looking for a difference between the two shoulders.
Right. And now I'm going to do it. Just rotate both palms up, and then we're going to compare and see what the difference is. Now, if you feel distinct pain in the shoulder joint,
While I'm pushing down.
yep, it's positive, particularly if the thumbs are down for injury. Is more anterior and posterior, if I remember correctly. Either way, you're going to feel it. Now, I personally, it's semi-positive.
Sure.
It's not waking me up like, oh.
More on this side than that side.
Yes, exactly.
Sure.
Now, so if that's positive, you just say, well, it doesn't mean you have a labral tear. It means that's an indication that
right.
you may have one there. Now, the next test, I stand with my feet squared up on the floor, about shoulder width apart. Now, this arm, the involved arm, and you should probably do this on the uninvolved arm first, just to see
Sure.
how it feels, and then compare. So I'm going to go back like I'm going to throw a baseball, and I'm going to go back comfortably so it's not painful.
And I'll be giving some resistance.
Right.
So I'll stop him from moving forward.
It's going to be like Bob's hand is a wall. It is not going to allow it to move. With my opposite leg, my right leg, I'm going to step forward like I'm going to throw the ball, come forward, and then I'm going to push. And you can feel if you have pain in the back side of the shoulder, a sharp pain in the joint area.
Right.
Now,
right.
that too was a kind of a semi-positive.
Sure.
So do I have a labral tear, Bob?
We don't know.
But indications are there's some other tests that I've looked into, but I think you have to have palpatory skills.
Right,
You need to be a
right.
therapist or a doctor to get in to feel the biceps tendon.
I definitely think you have some labor involvement.
Right.
I think this is not totally fine.
Right. So we should mention the bicep, the long head tendon actually connects to the top side of the labrum. So if you do have problems with curls when we're working below the level of overhead and you feel some pain,
Which you do.
which I do, feel a pain in there, that's another indication it's labral. And that wouldn't make sense with
One thing you need
arthritis.
to understand about Brad, though, is that when he does something, he goes all out. So, like when you
Who?
swim, I bet you when you swim,
I'm starting to settle down.
How long do you swim?
Well, if I have a healthy shoulder, 45 minutes.
That's a long time. I mean, you may have to start.
Well, what are you going to do,
ramp
Bob?
it
You
down a little
can't.
bit.
I know, Bob, but I'm not going to do that until I have a problem.
You
It's a
have
personality issue.
Right.
It's common with people like me. They're out
Head
there.
problems, yeah.
Yeah.
All right.
So if you do these and you want to learn more about strengthening shoulder exercises, you're going to do any exercise that doesn't create pain. You have to avoid any sharp pain. We do have a whole list of exercises. If you go to bobandbrad.com, the program section, click on there,
Right.
go down, and you'll see a whole
There's
section
one
on shoulders.
Yes.
Click on there, and there's about 30 videos, plus or minus, on shoulder. And just look at the titles, pick out the ones that pertain to you for strengthening, and you're going to find a 10-minute video with a PDF printout.
Right. So you can print it out and you can take it with you and make sure you're doing the exercises right.
Right.
And plus, this is free.
Absolutely. We don't even ask for an email. It is
Right. That's our
completely
gift to you.
exactly right. So good luck with your shoulder, and I hope you can get back to swimming if that's your problem,
Your problem.
like mine.